Hello and welcome to Power Conversations at RBL Bank. In today's episode of Leading Ladies, we are very happy to welcome Khushboo Jain, CEO and co-founder of ImpactGuru. ImpactGuru is one of India's leading tech for good crowdfunding platforms that allows for individuals, social enterprises, and NGOs to raise funds for various social projects, medical emergencies, and other personal interests. Since its inception in 2015, ImpactGuru has helped raise 1,500 crores from donors spread across 165 countries. Khushboo Jain is a fashion marketeer turned social entrepreneur. In 2019, Niti Aayog confirmed her with an award for Women Transforming India. She's also been featured by Fortune 40 and Under 40 India list. Prior to co-founding ImpactGuru, she was working with Valorem in Singapore, where she was managing high premium lifestyle brands like Jimmy Choo. Hi, Khushboo. Welcome to Power Conversations at RBL Bank. We are delighted to be in conversation with you today.
Hi, Devika.
So I'm very excited to be in conversation with you because the social entrepreneur space in India is really evolving today. But I have to ask you that you were in the fashion, industry with Valorem, managing premium brands in Singapore. Your husband, who's the other co-founder, Piyush, was a consultant with BCG and earlier to that, an investment banker, I believe, right?
That's true.
Outside India. Yeah. So what made you, launch ImpactGuru? What was it that you saw that was an opportunity? Or what were you solving for when you launched ImpactGuru?
Right. So our vision, with starting ImpactGuru was to create a world where any individual would have the power to create an impact. And in this case, we're talking about saving lives. Back in the day, when Piyush and I were working/studying outside of India, we're talking about early 2000s, 2010s, right? So we're talking about 2013, 14-ish. And at that point, crowdfunding was becoming a very, very popular concept in the West. Whereas in India, no one really knew about it. And, we found the concept very interesting. So Piyush, while he was studying at Harvard, was working on this research paper along with a Harvard Business School professor on innovative, models of financing. And that's when he learned about crowdfunding and he realized that, hey, this is a very, very interesting concept, that brings together technology, finance, and social impact. And that is exactly what he was very passionate about. So that is how ImpactGuru got incubated at Harvard back in 2014. And at that point, like you said earlier, I was working in the lifestyle business, launching luxury brands, lifestyle brands in Singapore. I realized that, hey, what could be a bigger challenge? What could be a bigger marketing challenge than to convince people to be kinder, right? And so we decided that if we were to bring this concept of crowdfunding to India and solve for problems within India, healthcare financing being one of the largest problems that we've been grappling with over the years. In fact, even as a matter of fact, more than 50 million people get into the debt poverty trap on a yearly basis, just trying to fund their medical treatments. Now, that was a very, very big problem to solve. And in general, out of the Indian middle class, more than 500 million people are either uninsured or underinsured, which meant that if somebody was diagnosed with an illness like cancer, or suddenly if somebody needs an organ transplant, they'd have to put together anywhere between 5, 10, 15 lakhs to even crores, whereas they either had no insurance or had only 5 lakh worth of insurance. So there was a huge gap that needed to be funded, and that is how ImpactGuru was built, with the genesis to help people fund their critical illnesses with ease without necessarily, flushing themselves out completely. So that was the genesis, and the thought process behind why we started ImpactGuru. And today I'm very proud to say that we've already impacted more than 10,000 patients having funded their critical illnesses such as cancer, organ transplant, accident, and various other critical, medical conditions.
It does appear that most of the crowdfunding in the social entrepreneur landscape is skewed towards meeting medical expenses or emergencies. Are there other social causes also that you feel are now getting promoted because there is a little bit of acceptance of crowdfunding and there is more trust that is being built?
Oh, absolutely. Definitely, there are a lot of causes. In fact, ImpactGuru also supports causes other than healthcare and medical emergencies. So in that sense, we support all kinds of causes. But, medical emergencies tend to get a lot more support because of the sheer, gravity of the situation. It's a matter of life and death for these people. So of course, these kind of causes get a lot more attention and a lot more support. But having said that, yes, ImpactGuru has helped, support causes like, we've done a lot of disaster relief work. Even last year, suddenly when the country went into lockdown and we were not necessarily well equipped, there was, a lot of unemployment suddenly, a lot of layoffs, a lot of people struggling to make ends meet. And that's when ImpactGuru really stepped in and, we decided to use a platform beyond just healthcare financing, right? And we were able to raise crores and crores and create that kind of relief. So yes, disaster relief is another area where crowdfunding can work very beautifully, and we've already proven that. Other than that, memorial fundraisers work really well, especially in case of a family losing a bread earning member. Suddenly there's a lot of uncertainty, there's a lot of despair, there's a lot of financial insecurity that needs to be dealt with. So memorial fundraisers work really well as well, in general with crowdfunding and also at ImpactGuru. And yeah, other than that, of course, you have all of your social causes. We work with lots of wonderful nonprofit organizations that support causes ranging from women empowerment to environment to children, child education, etc. So of course, I mean, as a platform, crowdfunding is very, very, as a crowdfunding platform, we are very, very versatile. And yeah, we do support causes beyond healthcare as well.
Help us understand, how does the ImpactGuru platform work? How do you go about screening the various requests that come in from the fundraisers? And how do you evaluate which ones would you be taking up and going ahead with?
Right. So that's a great question. The moment somebody realizes that they are in financial distress, they need some kind of funding support, they can log on to ImpactGuru. Within 5 minutes, they can set up a fundraiser. So it is a DIY process. It is a completely do-it-yourself process wherein people, all they really need to do is put their fundraising title, set a goal amount that they need, put up some photographs and video appeals that can validate, tell people their story and why they need the funds. They can write about their background, the background of the requirement, put up the medical documents, and within 5 minutes, the fundraiser page can be set up. For every fundraiser, there is a dedicated crowdfunding coach. In other words, we also call them a relationship manager at ImpactGuru. So every fundraiser is supported by a dedicated relationship manager who helps people not just set up the fundraiser, but also with the technology, outreach, communication, so on and so forth. So that is how the fundraiser is created and managed. Aside of that, as far as the, and then of course, this particular platform that we've built, so the crowdfunding page, once it's created, is then integrated to the social media handles of the campaigner or the patient, whoever's trying to raise funds. And with the click of a button, they can share this fundraiser link via a WhatsApp message or a Facebook message with thousands of people within their network. And that's where the speed aspect comes in, right? And when their friends and family read about this message in their WhatsApp, they then come to the link and then start contributing. So the money first comes in from the immediate supporters, the immediate friends and family, and then of course through the snowball effect of social media and virality, strangers also start to come in and donate. we created medical crowdfunding history for the second time by raising 16 crores within a month's time for another baby. 2,64,000 donors from across the world came together to support this particular cause to put together 16 crores. And the average donation amount, you will not believe it, was a little over 600 rupees. And that is the power of crowdfunding. A little bit from a lot can be, a little bit from a lot of people can be a lot for someone, right? And that is the genesis of crowdfunding. As far as the validation of causes is concerned, we have a 4-step, process whereby the first thing we do is to validate the ask our campaigner to share medical bills, medical estimations, reports, etc., to support the cause, to support the validation of the cause. The second step is to then verify those documents with the concerned doctors and the hospitals. The third step is to then control the flow of the money. So once the funds are collected, we make sure that we transfer the money to, directly to the hospitals or pharma companies or even diagnostic centers directly, rather than give the money to the hands of the campaigner, because in any case, they're going to pay that themselves. So why not route the money directly to the hospital, right? To sort of ensure that donors are very, very comfortable. And then the fourth step is this inbuilt trust mechanism within crowdfunding, whereby if you do not receive initial support from your friends and family, even the strangers will not come in and donate. So no cause can necessarily be faked on ImpactGuru. And thankfully, we've been very, very vigilant about it. And we have managed to, ensure that funds are being used correctly on our platform. So yeah, that's as far as the validation bit is concerned.
So 16 crores to be raised with an average ticket size of 600 rupees. I think that's just incredible. And I think that is the message that we would like to send out there, right? That crowdfunding and for these related causes is not something that can be trusted. It's not something that is a fraudulent methodology to whisk you off your money. So tell me, Khushboo, obviously outreach is critical, right? And for that, today, technology, digitization is very, very important. How has technology helped you build ImpactGuru? How has it helped you build it? How is it helping you scale it up?
Absolutely. So technology is definitely the most important aspects of being able to deliver exceptional results for patients and their families, and thousands of these families, simultaneously. So definitely, it requires an incredibly complex infrastructure to be able to support, one donation per second kind of speed for multiple fundraisers at a time. So as far as technology is concerned, the one way that we are able to help people is to sort of make it very, very easy for them to start a fundraiser. Like I said earlier, within 5 minutes, people are able to start a fundraiser on ImpactGuru. The second thing they can do is integrate their fundraisers with their social media handles, so that with a click of a button, they can reach out to people, thousands of people in one go. Thirdly, what we've also realized is that people find it very difficult to tell their own stories. Sometimes they miss very important pieces of information. And as a result, while they might be able to mobilize funds from within their networks, but it's the strangers who can't really connect without having all the data points, right? And some of them miss out on receiving enough donations from these strangers. So what we've decided to do, and in fact, we managed to do this successfully about 3 or 4 years ago, is created some kind of a story bot where, just by answering about 10 or 15 simple questions, an automated fundraising story, an automated fundraising appeal is created for these campaigners who are not very, very, savvy or articulate enough to tell their own problems. So that's one of the innovative uses of technology. And I find that a lot of this sets our platform apart. And also a lot of people tend to use this feature because all of a sudden they don't really need to write their own story. All they need to do is just answer some of these questions, and there you go. A story is created in a matter of seconds. The other thing that we've also done using the power of technology is create automated videos, appeal videos. So, the world we're living in, this age of social media has made it very, very sort of, important for people to be able to communicate through videos. There's just so much video consumption that not very many people want to read. They want to listen to stories or they want to watch videos. So we've created, you know, a technology whereby automated video appeals can be created for these campaigners. Again, that's something only ImpactGuru has managed to do, amongst all of the crowdfunding platforms out there. So those are some of the ways in which we've already innovated. But then what I also realize is that we're at such a nascent stage, of technology evolution in the world of crowdfunding, that we will see a lot more significant disruptions, whether it is, being able to use vernacular language more effectively through technology, or even customize, fundraising experiences of campaigners basis their networks, their requirement, so on and so forth. So definitely a lot more disruptions yet to come over the next 1 decade.
So that's a very important thing that you touched upon, that we are in a very nascent stage of crowdfunding evolution in India. And one very important aspect of that is regulation, right? Also, if I understand correctly, there are 3 broad categories of crowdfunding. One is obviously the online crowdfunding, which I think falls in the domain of income tax authorities from a regulatory aspect. Then you have the P2P crowdfunding, which is regulated by the RBI. And then you have, which is currently banned in India, but is globally popular, is the equity-led crowdfunding category, which is in India governed by SEBI. Right? Help us, if you could give us some sense of what is the regulatory framework, the audits, and the compliance requirements that you are required to fulfill today. And what is the desired policy changes you would like to see come about, which would help build this as a popular, source of fundraising going forward?
Right. So let me take the second part first, which is the governance and audit part of it, because that is internal, that is within our control. So we have an incredible, advisory board and investors that we're backed by. And, these are people who carry a lot of experience in healthcare sector, finance sector, technology sector, and even social impact for that matter. So we're very, very well mentored and advised by our board of advisors as well as our investors. As far as auditors are concerned, our auditors are, appointed by the investors themselves. So on the compliance side, on the governance side, and also on the audit side, we're very, very proud to say that we're very, particular. This is something we take very, very seriously, and we make sure to check every box there is out there. In fact, we're one of those people who are extremely, extremely cautious about making sure that we're not making any mistakes on that front. But on the governance side or on the regulation side, there's very, as of today, the donations-based crowdfunding sector is not regulated in India. But I don't really want to talk about too much because these are things that are not necessarily in my control. So I'd much rather focus on things that are in our control, which is making sure that we are complying, making sure that, we are ensuring that our auditors are absolutely satisfied with all of the boxes that we're checking. And more importantly, focusing on our strengths, which is technology, creating a technology-based platform where we're solving a customer's need to help and help them, raise funds for their medical needs. So let me talk a little bit about the international market, though. In the international market as well, whether we talk about the US or UK or China, donations-based crowdfunding is a non-regulated sector. And part of the reason why I believe this might be the case is because all of the donations, we're just trying to create impact. The problem itself is so huge. The healthcare financing problem is so huge that, platforms like ours are only helping, if anything else, we're only helping sort of bridge that gap between whatever the per capita income might be and the fund or the lack of lack of insurance penetration might be when it comes to solving for healthcare financing. So that would be my take.
The important question that we would like to touch upon is the impact of the pandemic. How has that impacted you, as well as how has it, what has it been like for crowdfunding in India? It seems to be that it's been positively impacted during the pandemic, and a lot more people have been looking at it in a positive fashion. So what has been the impact of the pandemic on ImpactGuru?
So there were changes internally and externally. So let's externally, I mean, internally, of course, we had to, just like any other business, we had to suddenly adapt to working remotely, keeping in mind the safety of all of the employees. We were working remotely for almost a year. And I think last year at this time, I mean, last year in February, if you would have asked me if we'd ever be able to work remotely for a year and grow simultaneously, I would have laughed at the idea. But you know, as they say, the moment there are challenges thrown at you, you pivot. You know, you have to be agile, you have to adapt to the situation, and you have to turn that into an opportunity, that challenge into an opportunity. And I guess that's what we did. So while, yes, you know, settling the entire team into this smooth work from home, you know, routine, it took a little bit of getting used to, for sure. But I think on the other hand, externally, there were so many things to look at. You know, there was disaster relief with regards to COVID that I mentioned earlier. And also in general, COVID-19, we've also supported a lot of people who were suffering from COVID-19, who were hospitalized, not able to fund themselves. So in that sense, yes, we had to pivot a little bit. We had to be very agile and really use the opportunity at hand to make our platform as relevant as possible. So yes, our platform did grow. Suddenly, the demand for medical fundraising did surge because of a lot of COVID cases out there. The demand for disaster relief fundraising also surged, and a lot of nonprofits also, you know, decided to come on board, partner with us to again do a lot of on-ground work with regards to distribution of food, masks, you know, PPE kits, sanitizers. The elderly were very badly affected as well from the marginalized community. So we worked with some incredible organizations even to sort of support them. We worked with you know, organizations like Big Baskets, Rodha, and many others, you know, to be able to again support a lot of on-ground relief work. So yes, we were glad that our platform was, you know, ready and could immediately handle that kind of demand.
Yeah, I was basically asking, what are the kind of partnerships you're looking to forge? What have you done in the past? Because there have been some very interesting partnerships that you have forged in the past. And what are you looking forward to in the future?
Yeah. So in the past, definitely, we've been very fortunate to have partnered with the Epic channel, whereby this was back in 2017, when they wanted to, you know, they started this TV show called Ummeed India, whereby they were covering the journeys of a lot of these, you know, aspiring Olympians for 2020, who were, because the prep work had already started at that point. So a lot of these, you know, Olympians had these very interesting stories that they were covering on their TV show. And what they also realized is that most of them come from very humble backgrounds, and they needed a lot of support, funding support. So that's when they reached out to us and they asked us to, you know, take care of the fundraising side of things for these athletes, so that while, you know, it wasn't just about covering their story, but it was also about changing their story for the better, right? So equipping them with the right kind of, you know, training and nutrition and financial support, so that they could focus on training and really perform well at the 2020 Olympics. So that was one of the partnerships. The other partnership that we did was with the movie Chhapaak, the Deepika Padukone starrer Chhapaak, wherein you know, it was a great platform for us to do a lot of advocacy around acid violence and the kind of lives these women have to lead after such unfortunate incidents in their lives, and the kind of stigma they have to go through. You know, their job prospects suddenly get impacted because you know, of the way they now look. So there was a lot of you know, advocacy and fundraising around acid violence victims as well that we did through this partnership with the movie Chhapaak. we've again during COVID, we partnered with Big Basket, like I mentioned earlier. So at every stage, I've realized that there's very, very different kinds of partnerships that we've done to sort of support different kind of causes, and that is the beauty of our platform. It is so versatile and it is cause agnostic in that sense that any and every kind of cause can be supported, right? With the right use of technology.
Khushboo, while I'm talking to you, what really comes across to me is your passion, right? And your positivity. And this is like something that I'm very impressed with as we are in discussion right now. I'm also very sure that you mentioned all the successes that ImpactGuru has had, but I'm sure somewhere along the line you would have had some challenges as well. And with the highs would have come the lows. What were these challenges and what have been your key learnings through those times?
I think it's very, very normal for any entrepreneur to go through challenges. Of course, we went through multiple pivots, we went through multiple lows. Crowdfunding itself was such a new concept in India. We had to customize it. We really, really had to refine the product a lot to find the product market fit. Finding early customers, early believers of crowdfunding, finding investors at early stage, who would back our vision, who would support what we were trying to do. I think the learnings that I would have to talk about would be that, it's very, very easy to give up. Markets will change. Suddenly, customers will not be happy with what you've given. So I think constantly listening to customer feedback, aside of just, crunching data. I mean, data crunching is very important. And we definitely pride ourselves in being an organization that really, really analyzes data to its granular level, but really, really listening to customers. There are times, even today, we have a 200-member team. And even today, I like to pick up the phone and speak to customers every now and then because I want to stay in touch with them. So I think really, really staying in touch with your customers, getting firsthand feedback from them is so important. And there's so many things we learn even today after these many years of operations.
And what is your source of inspiration, Khushboo? Who and what inspires you?
There are obviously a lot of inspirations in my life. I think my mother being my number one inspiration, because I've seen her go through some incredibly difficult times. But she has been in social service for the past 25 years herself. And I've seen her sort of balance so many different things, home, children, family, her social work. I've seen her lead from the front. I think she's definitely one of my inspirations. And I think amongst public figures, if I had to pick one person, it would have to be Ellen DeGeneres. I'm a huge, huge fan. I just love her energy. I love how she has this amazing sense of humor. She's always super joyful, but at the same time, she's creating so much impact. She knows how to bring a smile to everybody's face, whether it is with her humor or with the humanitarian efforts that she puts in. Which are very, very deep rooted. And in general, just about how unapologetic she is. I just love how she is. And I definitely draw a lot of inspiration from her.
So what next for ImpactGuru, Khushboo? What is it that you're looking forward to?
So, we've helped more than 10,000 patients, like I mentioned earlier already. But our mission is to support at least 1 million patients grappling with critical illnesses get quality access to healthcare. Over the next 1 decade, we want to help at least 1 million people. And I feel like we've barely scratched the surface. We've just begun and there's so much to do. And it's only possible through, the power of technology, the power of listening to our customers, to keep the passion going, even on tough days.
And before I let you go, I would like to also know from you, are you still in touch with lifestyle and fashion, or is that now a thing of the past?
I think it's my first love, and I don't think I'm ever stepping away from that. So it's always going to be a part of my life, one way or the other. But for now, of course, ImpactGuru is that one kid which needs my maximum attention. But yes, lifestyle and fashion will always be a part of my life, one way or the other.
Great to know, Khushboo. It's been a terrific conversation. Thank you so much for your time. And here's wishing you and the entire team at ImpactGuru all the best. May you get to that 1 million social impact number sooner than later. All the
Thank you
best.
so much, Devika. It was such a wonderful conversation. And thank you for all the reassurance. We need it. We need it. Thank you so much.